Hi everyone and welcome to my presentation. My name is Dr. Shiva Hadadian and today I would like to concentrate on cervical cancer and HPV vaccine. So let me share my screen. Okay. As you can see on the screen, our topic today is cervical cancer. So what is cervical cancer? The uterine cervix is the lower part of a woman's uterus. In other words, it is the opening of the vagina from the womb. Cervical cancer is a type of cancer in which the cells of the uterine cervix start to grow more rapidly and uncontrollably. They may also grow to deep cell layers or spread to other organs. It is interesting to know that most cases of cervical cancer are found in women younger than 50, but it is rare in women under 20 years. Okay, and what is the main cause of cervical cancer? 99% of all cervical cancer cases are linked to infection with high-risk strains of human papillomavirus. You can get infected with this virus from any skin-to-skin contact of the genital area, vaginal or anal sex. More than 150 types of HPV exist, but only 13 types of this virus may cause cervical cancer, among which HPV 16 and 18 cause about 70% of cervical cancer cases. It is worth knowing that an HPV infection is usually temporary, and most people with HPV infection never know that they become infected because the HPV infection will go away on their own without causing any problems. What are the other risk factors for cervical cancer? Aside from HPV, other risk factors that put you at risk of cervical cancer include becoming sexually active at a young age or with multiple partners, which increases the risk of developing cervical cancer. Researchers think this is related to the cervical changes during puberty that make the cervix more susceptible to damage. It is worth knowing that a condom doesn't completely prevent HPV, but it is still important because it helps protect against other sexually transmitted diseases such as HIV and chlamydia. Weak immune system. If you have HIV or take medication that weakens the immune system, the risk of getting cervical cancer is higher than average population. Smoking. According to the American Cancer Society, women who smoke have about twice the risk of cervical cancer than non-smokers. Researchers believe that tobacco byproducts reach cervical mucus and damage the DNA of cervical cells and contribute to the development of cervical cancer. Smoking also increases the chance of an HPV infection not going away on its own. Using oral birth control pills. Long-term use of oral contraceptive pills has been associated with an increase in the risk of cervical cancer. But if you stop taking them, your risk may go down again. Personal history of cervical cancer or having a sister or mother who had cervical cancer increases your risk of cervical cancer. And last but not least, diets poor in fruits and vegetables, vitamin A, C, and E put you at a greater risk of getting cervical cancer. Now, let's talk about the main symptoms of cervical cancer. Most people think that if they don't have any warning signs and symptoms, they certainly couldn't have cervical cancer, but it is not true. Cervical cancer often has no symptoms, but if symptoms occur, the first one could be abnormal bleeding between the periods or after sex. Your periods may be heavier and last longer than usual. Watery or unusual discharge can be another symptoms of cervical cancer. With advanced cancer, you may experience pelvic pain, problems urinating, and swollen legs. Since these symptoms can be caused by other conditions, you should check with your doctor to get a definite diagnosis. Now, this question arises: how to detect cervical cancer early? Screenings are the best way to detect cervical cancer early. Early detection of cervical cancer can significantly improve the treatment outcome. The most common tests for cervical cancer screening are the HPV test and the Pap test. Since cervical cancer is typically a slow-growing cancer and it usually takes 3 to 7 years for high-grade changes in cervical cells to become cancer, getting regular cervical cancer screening help find precancerous changes before they become cancer. What is Pap test? A Pap test or Pap smear is a simple and fast procedure in which a small brush is used to gently scrape cells from the surface of the cervix so they can be checked with microscope for cancer cells or cell changes that may lead to cervical cancer. Abnormal findings of Pap smear are often followed up by a diagnostic procedure. Usually, the sample taken for the Pap test is also used for the HPV test. So, what is the HPV test? An HPV test is another screening test for cervical cancer. It detects the presence of certain types of HPV, including type 16 and 18, which increase the risk of cervical cancer. Getting a positive HPV test result doesn't mean that you have cervical cancer now, but it is a warning sign that shows you may develop cervical cancer in the future. Your healthcare provider may recommend additional tests such as colposcopy or cervical biopsies. Now, it is important to know how often cervical cancer screening should be done. According to the American College of Obstetricians and Gynecologists, women should start their cervical cancer screening at age 21, regardless of when they first start having sex. Women aged 21 to 29 should have a Pap test alone every 3 years. HPV testing alone is another option for women who are 25 to 29, but Pap tests are preferred. Women aged 30 to 65 have 3 options. They can do a Pap test and an HPV test called co-testing every 5 years, or they can have a Pap test alone every 3 years, or they can have HPV testing alone every 5 years. The next question is, when should I stop having cervical cancer screening? According to the American College of Obstetricians and Gynecologists, women aged 65 or older should stop having cervical cancer screening tests if they don't have a history of moderate or severe abnormal cervical cells or cervical cancer, and they have either 3 negative Pap test results in a row, 2 negative HPV tests in a row, or 2 negative co-test results in a row within the past 10 years, and their most recent test should have been done within the past 3 or 5 years, depending on the type of test. But keep in mind, if a woman has a history of cervical cancer or high-grade cervical cell changes, she should continue her cervical cancer screenings for 20 years following surgery, because cervical cells can be present at the type of vagina even after total hysterectomy. So, how can I reduce my risk of cervical cancer? Vaccination against HPV is one of the best ways to reduce the risk of cervical cancer. The American College of Obstetricians and Gynecologists states that the ideal age for vaccination against HPV is 11 or 12, but it can be given starting at age 9 through age 26. At the moment, 3 HPV vaccines have been licensed in the United States: Gardasil, Gardasil 9, and Cervarix. But Gardasil 9 is the only vaccine that is used in the United States since 2016. And finally, do I need cervical cancer screening if I'm already vaccinated against HPV? Since the vaccine doesn't protect against all types of HPV infections that cause cervical cancer, please keep in mind that even if you are fully vaccinated against HPV, you still need to continue regular cervical cancer screening. Thank you for your attention.